I'm also the Minister of Health and the President to make sure that these Kenyan citizens' public health safety is protected.
Okay.
And even our visitors, our other global people from other countries who live in Kenya, who work at the UN, who work in multinational institutions, who work in even development partners in the health sector.
Health Cabinet Secretary Aden Duale has clarified on government plan to establish Ebola facility treatment in Laikipia.
It's happening. I had an opportunity to visit those areas when I was a Minister for Defense. There are over 350 Kenyan KDF soldiers working for the UN, MONUSCO, as we speak today. A whole battalion of signal and the Kenya Defense Forces quick response team. We have a huge population of Kenyans doing business in DRC. Our two major banks, Equity and KCB, are based in DRC. So before we are even concerned with why are we bringing Americans, we should be concerned with a Kenyan or any other person who crosses the border between 12 to 15 hours, has no fever, comes into our country. The incubation period is 3 weeks. After 3 weeks within our country, he develops the fever and all the symptoms. By then he has had many contacts with our citizens, with his family, and then he's found with Ebola. And there's no way where it is said we are bringing Ebola patients to Laikipia. That facility is a military facility. Kenyans Defense Forces will use that facility. Other Kenyans will use that facility. And by the way, let me say this. I don't know why people are so much about the US. If there's one country that has contributed between 25 to 35% of the health budget since independence, is the US, among many others.
Aden Duale further revealed that since a petition had been filed to stop them from setting up the facility centers, a notice was given to them to submit their files as the respondent within the next 48 hours, which they have already done so.
Only by us. We played a role, but we built it with partners and other countries, WHO, the US being one of the biggest funder. So Laikipia is one of the isolation center, and it is very far from any community, even within the barrack. And now that we have a court order, the court has told us, given us 48 hours to submit our submissions. The Attorney General, the Chief Legal Advisor, has already submitted the submission. So it's not about, we are not talking about a normal situation. It's not about something that, I saw what my good friend, Dr. Atela, what his message, he was saying that we should close our border to anybody, is different from what Dr. Tedros of WHO, if you watch either CNN or Al Jazeera, was urging the neighboring countries that let's work together. Let's make sure this Ebola virus is contained, all of us together. It is possible.
All right.
The health CS further revealed that setting up a facility of Ebola in Laikipia is among the facilities that is being set among 12 facilities across the country, clearing the air that the facility is only going to be built in Laikipia.